So I would like to welcome all of you. So all the esteemed guests, dear ladies and gentlemen, the proud parents of the most beautiful children, the precious gifts of God, and our media partners. I welcome you all to this cradle event that which we are celebrating the parent. So this event, so we are Oasis Fertility. So Oasis Fertility is a unit of Sadhguru Healthcare Private Limited, which has redefined the productive care in India by bringing in internationally recognized best practices and protocols in fertility treatments. It offers the would-be parents a friendly one-stop daycare clinic where consultations, investigations, treatments are all conducted under one roof. Since its inception in 2009, Oasis has gained an excellent reputation for its high success rates, driven by its high-quality services, led by a team of experienced infertility specialists with international experience. The chain has expanded to 30 plus centers across the states of Andhra Pradesh, Telangana, Tamil Nadu, Karnataka, Jharkhand, Gujarat, Maharashtra, and Odisha. Why we have gathered today? The reason today we all have gathered is to take a moment to celebrate the auspicious parenthood and to celebrate the presence of the beautiful souls of God amongst us. Now, I would like to introduce the backbone of Oasis Fertility, the doctors and the embryology department. So we have with us Dr. Prachi Kulkarni and Dr. Akila Ayyagari. Dr. Prachi is a consultant at Oasis Banjara Hills. She is a fertility expert with vast years of experience in handling difficult cases of PCOS, endometriosis, and recurrent implantation failures. Dr. Prachi has completed MBBS from KJ's Somaya Medical College, Mumbai, and DNB in Gynecology and Obstetrics from Dr. Balasaheb Ambedkar Memorial Hospital. She has also done advanced diploma in reproductive medicine and embryology from Germany and certificate course in ART. She has completed the International Society of Ultrasonography certification in Obs and Gynae and Foxy Basic Ultrasound training. Now, I would like to take the opportunity to introduce Dr. Akila. She is also a consultant here at Oasis Banjara Hills. She has completed her MBBS from Jawaharlal Nehru Medical College, Delhi University, her DNB in Obs and Gynae from Tata Memorial Hospital, Jamshedpur. She earned her ICOG Fellowship Reproductive Medicine from Swapna Health Center. Dr. Akila completed a fellowship in fertility enhancing surgery from Saidham Hospital, Rahul. She went a compulsory rotatory internship at Gandhi Medical College, Hyderabad, and has completed a course in gestational diabetes mellitus from Dr. Mohan Diabetes. Now, I will be requesting our consultants to share a few words with one and all. First, I would like to request Dr. Prachi to share a few words with everyone.
Thank you, Dr. Karas. At the outset, let me welcome all of you. Thanks a lot for coming here and blessing this occasion. It's very nice to see our patients coming back with the babies with smiling faces. And we are really thankful to all of you to give us this opportunity to be a part of your parenthood journey. And thanks a lot to for trusting Oasis Fertility in their journey, and we are really happy that you came with a dream and we could be part of your journey and you we see that dream come true with those little bundles of joys in your hands. So it's very nice to see all of you. And as you are aware, Banjara Hills is the main center of Oasis Fertility. We get many complicated or difficult cases, or many patients who have had failed multiple IVFs, and they do a lot of stuff, and then they come to Oasis Fertility. And we are privileged, and I feel humbled to have this opportunity to treat these difficult cases and patients, and when we see that their dream has come true, we really feel proud and happy for whatever we have achieved. So as you all are aware, we have this center as the main center, and all the fertility related treatments that we are doing with a lot of transparency and ethical practice, and all the newest technology, including PGTA, PGTM, PGTSR, all the donor facilities also, and hysteroscopy, laparoscopy, fertility enhancing surgeries. So with expert team of doctors, embryologists, and all the supporting staff, and it's definitely a teamwork when it comes to taking a patient who is coming to the OPD for the first time through their fertility treatment, which are most of the times quite stressful, till they deliver a healthy baby. So it's definitely a teamwork, and I'm very thankful once again to all of you. So I'm very thankful to all of you for coming here, and really glad to see you all. Thank you.
Thank you, Dr. Prachi, for the insightful information. And now I request Dr. Akhila to please share a few words with all of us.
Thank you, Dr. Faraz, for the introduction. A warm welcome to all the new parents with your bundles of joy. We are extremely happy to see you here today, and congratulations for the dream that you have had and it fulfilled. I would like to tell you, take the opportunity to tell you that here we deal with all the high-risk cases in infertility, and a timely decision is something that would help you. So all cases, all women who have been trying for quite some time, take the right step, come to us at the earliest, and the right intervention would help you reach your dream of parenthood. This is what I would really like to tell you. The right decision at the right time is what it takes. So thank you very much for coming here, and all the very best to all the couples there.
Thank you, Dr. Akhila. That was indeed great to hear the words. Now, I request our beautiful media partners, if you have any questions, anything that you would like to ask to our consultants, so we can proceed with that.
There is in case of a late mother.
Please state your name and any specific doctor if you want to ask, or any doctor. And the question, please.
Any doctor can answer. I just wanted to know that these days late motherhood is become a norm kind of a thing. But with that, there are added problems that are being faced, especially gestational diabetes or hypertension, and also the Down syndrome. So, what is the percentage of mothers that have been successful in Oasis in terms of, motherhood? Because most of the cases that are coming now are late motherhood, right? And then again, the government has put a norm that they cannot be surrogacy beyond a particular age, or a test tube baby beyond a particular age. So that is also acting as a hurdle. So how do you really, ensure that the couples are well informed on that?
So let me start with the ART bill. The ART bill has been passed in July 2021. So 22. So we are following all the norms led by the government, and that is most important for patient safety, because whatever pregnancy related physiological changes happen, the woman should be fit enough to go through all those changes without much complications in pregnancy, and should achieve her parenthood dream. So our first goal would be to look after patient safety. So we abide by all this, the government regulations and ART bill. So according to ART bill, the age of female for IVF is 50 years. So beyond that, we should not be considering the fertility treatment because of patient's health safety. So whoever is coming at higher age, it depends, the success rate will depend upon many things: her age, her AMH value, her egg reserve, also any other medical conditions which are associated. So I would like to take this opportunity to bring to your notice that it's not just the age but your lifestyle which plays a major role. So right from the beginning, it's not like once you cross a particular age you should pay attention to your general health or look after your weight or see that your other health conditions are settled. Right from the beginning, when you enter adulthood or maybe from childhood itself, that you should look after your diet, your regular schedule of exercise or some form of physical activity, so that you remain fit at in adulthood also. So when you start your motherhood journey at a healthy BMI at younger age, definitely the complications will be less. But when you come at higher age also, if you are medically fit, then the chances of complication would be less. So whoever comes to us after 35 years of age, our first goal is to see that patient is fit. So if somebody is on the higher weight, we ask them to reduce the weight and simultaneously start our treatment, so that we don't end up wasting too much time. Also, if any medical conditions like diabetes or hypertension or any other medical conditions, we ask them to constantly keep follow-up with those doctors to keep those conditions under control so that the complications don't happen. Also, I would like to let you know that in Oasis Fertility, we have oocyte cryopreservation as well. So nowadays, we do get many unmarried patients who come to us who don't have any immediate future plans of getting married, or if they are married, getting pregnant. So they can, like if they are married, they can go for embryo freezing. If they are not married, they can go for egg freezing. And if they maintain their fitness at later date, maybe a few years later also, they can come back and get the embryo transfer done and achieve their dream of parenthood. So if they come around in their early 30s or then it is advisable to go for egg freezing for social reasons also, so that at least the complications due to higher maternal age, which are related to miscarriages, which happen due to higher maternal age and aneuploidies, that risk will be reduced. Other risk, which is medical risk, which is related to the lifestyle or other disease conditions, we have to counsel the patients properly, take the consultation from dietitian and physicians, and if required endocrinologist, to maintain their conditions under control when they start off their motherhood journey. So when you are healthy at the beginning, then the entire journey would be safer, and it will be less stressful and also with less complications to the baby and mother. So we do see many patients nowadays, higher age, but all these things will help them.
So what is the cutoff for male person, like 55?
For IVF,
Yeah.
it is 55
And
years.
also, what is the percentage of complications that arise from late motherhood? What is the percentage of people who undergo Normally, most of them are complicated cases at a later age.
So if you see only age as the risk factor,
No,
then
of course there is other underlying factors as well.
right. So if higher age, as you said, will have higher chances of having abnormal babies or miscarriages because of aneuploidies. So that percentage would be after 42 years would be almost 80%. So when we counsel them, that this is a very important point. When you take the decision of going for a fertility treatment, even if you go for IVF, we should be considering the age. If you wait too long, like if you're crossing 40 years and 42 years, then it is better to go for IVF with PGTA to rule out aneuploidies. And based on their reserve also, they have to understand they may have to undergo multiple cycles of IVF to get enough number of euploid embryos in hand for transfer. So after 42, it is almost 80% abnormal babies can happen. So better to go for PGTA.
Can you answer this? Why IVF failure reason? IVF failure reason.
Hello. So there can be the most important reason for an IVF failure is the quality of the gametes. That is the quality of the egg and the quality of the sperm. We have a number of techniques to try to judge, but there is no specific test